And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, good evening and welcome to Boomer Life here on CIL 650. I'm Sterling Fox, and on today's episode, we're going to focus on your health and your lifestyle. Back in studio with us from YesWellness is Dr. Paul Zickler. Hello, Dr. Zickler. Good to see you again, sir.
Good to see you as well, Sterling.
Well, we got a great story to tell about yourself, but first of all, what is YesWellness?
Well, YesWellness is a prodigy of sort of the things we talked about the last time we talked about in terms of my interest in complementary medicine and how that relates to allopathic medicine. And the two working together sort of set me on a path in terms of what can we do to improve our wellness. And so we launched YesWellness.com in terms of addressing lifestyle and changing your outlook in terms of being well instead of treating just the symptoms of disease.
Right.
And
but that's how we're kind of educated. Here in the Western North American society, we don't usually interact with medicine and medical professionals until there's something wrong. And you're trying to bring us to the more Eastern approach, which is proactive, which is stay healthy and be an advocate for yourself.
Absolutely, and one big part of that is sort of stressing the positive sides of lifestyle changes, but empowering you as an individual to take responsibility for your health. And by no means am I saying that it's allopathic versus complementary. I think that the two combining to provide the very most optimal treatment plan is the best.
Okay, a couple of terms there, and we'll come back to complementary, but what is complementary medicine and what is allopathic medicine?
Well, allopathic means conventional medicine. What we're used to seeing going to your family doctor today.
Gotcha.
And complementary means a whole host of other disciplines of healthcare, naturopaths, nutritionists,
Mm-hmm.
Exercise therapist, herbologist, people that are primarily interested in terms of supplements. So there's a whole host of complementary folk out there that are doing really good work, and we shouldn't be ignoring some of the outcomes that they're getting in terms of treating the person as a whole and looking for the roots of their illness as opposed to just treating their symptoms.
Reacting to what's wrong at the moment.
Exactly.
Right. Now, it's an interesting story, and I'm glad you took a second to explain the differences because you are the product of allopathic medicine. You were an emergency room physician at Royal Columbian in New Westminster for almost 20 years.
Yes.
You practiced traditional North American Western medicine, right?
Yes.
So what caused you to go from that perspective and doing excellent work? You essentially created a lot of emergency procedures and protocols during your time at Royal Columbian. But what caused you to think beyond that, beyond the traditional North American allopathic forms, and even consider this whole complementary spectrum?
Well, it's an interesting question that you ask, and the big thing was the fact that I felt that I was being frustrated by my ability to make people better. And what is my definition of being better? Well, it wasn't just I wasn't being fulfilled by my role in terms of being a family doctor and giving my prescriptions out on a regular basis. Is your blood pressure controlled? Is your blood sugar controlled? Is your cholesterol level controlled? And then, you should be paying more attention to your lifestyle and your nutrition.
Right.
And here are a few things in my short period of time of what you should be doing. And finding that, 1 out of 10 of my people would never make any changes in their lifestyle, nutrition, or to improve their health, but they were counting on my pills that I was prescribing to them on a regular basis, and those pills were increasing in number and increasing in dosages.
Well, we are a pill-popping people. If we have a problem, by gosh, doc, somebody's got a pill for it. We're sort of raised that way.
Well, that's a very good point. And so a lot of patients, that's all they want. Just
Yeah.
give me my pills. And so that added to my frustration. And so that's where, when I was being more exposed to more complementary styles of medicine, there was different approaches. And I was, at first very reluctant to be open to those. But when I started thinking, okay, well, something's going better than what I'm doing.
Right.
And when I started listening to sort of the outcomes of different types of care, it all of a sudden became impressive to me that we can be doing things differently so that these people are going to be getting better. They're focusing on their wellness as opposed to their illness.
Right, right.
And once I think that the medical community is looking at other alternatives, ways of improving their treatment plans, we are getting better outcomes. And I sort of touched upon that the last time we were together, where there's a movement now to incorporate the conventional medicine or allopathic with that of complementary or alternative, which included all the disciplines I've just mentioned to you.
Right.
And putting that together in a format that really encourages and empowers people to take an active part, to empower them to make themselves healthy. It's not the physician that's directing you. Listen, you got to do this.
Right.
It's the patient working in conjunction with that team and saying, I'm doing this and you're helping me do that. There's a different focus.
Absolutely. But I'm curious, though, because you've mentioned, as a typical North American doctor, raised and educated in our system of medicine, you were initially resistant to this complementary or alternative medicine, the whole field, as the Canadian medical establishment has been. So what was it that made you cross the line to actually go, okay, maybe I've got to just get over being a typical Canadian Western trained doc and look at a bigger picture? What caused it? Was there a specific incident that made you go, there's got to be a better way?
Well, I think, it does bring back sort of the most frustrating aspects of working in the system as it is now, for the most part. And for example, doing a full physical examination does give you some extra time to spend with the patient, and there is a time period that's longer than the average time period for a visit.
Right.
And so, say the typical 50-year-old, 55-year-old person and would come, whether it's male or female, but most times I found the men to be more reluctant than females to heed advice. And I would spend a significant portion of my time going through what I felt was some of the changes they had to do to make themselves well, and not rely on medicine to make them better. And I would have them back in, say, 3 months, and ask them, well, how'd you do with some of the suggestions I made? And 1 out of 10 maybe would have acted upon some of the advice I gave them. And that became so frustrating. And you sort of question your effectiveness. Well, what the heck am I really doing here? If they're really, why aren't they listening?
Because they're there for a pill, aren't
Yes.
they? In many cases, they don't want to hear your advice. They just want a pill. Thank you very much. Now I've got to go. Bye.
Well, they haven't been empowered to look after themselves.
Is that an education thing as much as anything else? Is it cultural?
It is. It is an educational thing. And I think you have to create an environment for them to make that switch. And my 15 or 20 minute, sort of discussion on changing your lifestyle and affecting change didn't cut it. And so you need a more sort of combined approach where you have to be like the old practitioner, like the old family doc that was had your complete trust,
Right.
and have that communication, that sort of relationship with your patient, where I'm going to help you be better, and my team of helpers are going to take part in that. And hopefully by the time we go through a much more involved process of how to do this in a very schematic, simple, functional way, that we're going to encounter change.
Okay. What's the status right now? What about today's graduating class from Canadian medical schools? Are they, Dr. Zickler, more likely to be more open-minded than you were when you graduated medical school with respect to at least giving some credibility to alternative medicine?
I think so. If you certainly even compared it to when I graduated to now, certainly the doctors today are becoming a lot more open to other forms or other treatment plans that might be helpful in terms of actually making patients well.
Well, for example, one can now receive a degree in traditional Chinese medicine in Vancouver. Used to be, if you wanted to follow that discipline, you literally had to go to China.
Yes, and the other treatment areas in terms of functional medicine that we talked about, there are specific programs, postgraduate programs that are going to educate you in all the other disciplines of complementary care that you can incorporate with your conventional medicine. The process of that delivery is really important.
Right.
The process of that delivery to empower the person to take their responsibility to direct his wellness, that depends on the assistance of others around him. They're not going to do it for you, but they're going to help you achieve your goals in terms of wellness. And I think that whole change of sort of thought and how to approach your wellness is what's really important.
Well, you can see even societal changes. For example, sure, we still have walk-in clinics, but a lot of them are now called wellness centers. So there is a bit of a sea change going on.
Yes, and I think that's only a good thing.
Okay, and when one refers to wellness as a concept, we're talking about the big picture, aren't we?
Yes, and wellness encompasses the whole aspect of lifestyle. So, what nutrition, what things are we going to do nutrition-wise to make us better? What types of things are we going to do in terms of exercise that's going to make us better? How can we control our stress in our environment, at home and at work? How can we sleep better? How can we control the amount of environmental and chemical toxins that we expose ourselves through our life and food? And what other issues and how we interact with our environment on a daily basis? All those things affect your lifestyle. And a lot of people think, okay, I'm going to exercise my way to health, when really nutrition is 80% of what's going to make that better. Exercise is 20%.
Really?
So it's ultimately really important. But all those other aspects that I've mentioned affect sort of that hormonal balance, that metabolic hormonal balance in you, that's going to create all the positive features of a good lifestyle.
Okay. So again, when we opened the program, we said we're going to talk about your health and your lifestyle because they're absolutely interconnected.
They're absolutely interconnected. You can't have health without appropriate lifestyle. When you look at it, that encompasses.
Yeah, your well-being or lack thereof is directly attributable to your lifestyle.
Yes, exactly.
So it must have been frustrating. So you need to lose 15 pounds, you need to stop smoking, and you need to take these pills for your blood pressure. So the guy gets home. So how was the visit to the doctor today? Oh, he gave me some pills for my blood pressure. And that was it.
That's exactly
So
right.
in one ear and out the other.
Yeah.
So we've got to make some of this material stick here.
Exactly.
On the program today. We're talking with Dr. Paul Zichtler from YesWellness on this episode of Boomer Life here on CIL 650 with lots more still to come. Stay with us.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.